In a simple surgery through Andre's nose, Dr. Smith finds the deviation.
There's the culprit. I see it. That's the bone spur.
A friend suggested she see Dr. Kevin Smith, an otolaryngologist.
Most of these patients I see have had some type of trauma, but don't recall it.
In comes Dr. Kevin Smith.
Yeah, it's all just opacified, just filled with something.
The first and only doctor to scan Andre's head. The first and only to offer a reason for the pain.
When something is not right there and there's some abnormal contact point, we need to get this pain triggered and refer to other parts of the head.
Dr. Smith found that Andre had a deviated septum, a bone spur pushing into his sinus cavity.
If it's overlooked, it can give you a lifetime of this misery.
Do you suffer from severe headaches that you think are migraines? Those headaches could be caused by a bone spur in your nose. A simple 30-minute procedure could provide relief and may be covered by your insurance. Call my office or visit my website. I'm Dr. Kevin Smith.
All brides and grooms want to look their best on their wedding day, but just how far would you go? You're about to meet a handsome couple who both had plastic surgery right before their wedding, and they say the surgery helped make it a picture-perfect day.
For Amanda, a computer sales whiz in Houston, there's something about her face that has troubled her ever since she was a child.
You can see that my nose doesn't fit my face. I just want it to look smaller.
Amanda also wants puffy bags under her eyes removed. While Trevor sports a buff athletic look, his long hair also masks emotional baggage from his youth.
I got the big ears. I understand that.
So, in a romantic twist, Amanda and Trevor decided to get plastic surgery together on the very same day.
This is very unusual, and I think it was kind of cool.
Houston plastic facial surgeon Dr. Kevin Smith goes over the procedures and says scheduling surgery together is smart.
And helps them to establish a little bond.
Amanda is first to go in the OR. Dr. Smith begins with the delicate under eye tuck, removing the puffy excess tissue. Next, he moves on to Amanda's nose. And after Amanda's cleaned up and bandaged, Trevor comes in to escort his bride-to-be down a different aisle to the recovery area.
I'm next.
Now it's his turn in the OR, and watch as Dr. Smith pins back Trevor's protruding ears.
Before, after.
A bandaged Trevor is then wheeled into recovery to join Amanda.
Where are you, baby?
After sharing a kiss, Trevor and Amanda are whisked one step closer to their wedding in Hawaii. Remember Trevor before? And now his ears no longer stick out. And remember Amanda before? And now after, with the smaller nose she always wanted.
I think it was definitely worth it. I mean, we did what we needed to do to make ourselves look beautiful and look the best for our wedding.
Experts say the number of wedding party members getting cosmetic procedures is up 300% in the last year.
Today, we're teaming up with Esquire magazine to find the real man who can proudly wear the title Best Dressed. The magazine's editors wanted to recognize the average Joes with a sense of style all their own. So for the second year in a row, Esquire magazine put out a call for the best-dressed real man in America.
But there was just something about these five guys that stood out, so let's get right to our finalists. Now, Kevin Smith is next. He's 46 years old, a facial plastic surgeon from Houston, Texas, wearing that seersucker suit, a little bit of a throwback. He looks great, though, with a bold shirt and tie.
Yeah, you know, seersucker never goes away, especially in America, and it's so great for the climate, certainly in the South, but it really works everywhere.
Okay, Dr. Smith, what causes this septum to become a deviant?
Well,
what causes it to be deviated?
well, as you grow and you go through life, life can be very traumatic. So coming through the birth canal, I tell people it's traumatizing to the face because the baby's face is pressed against the mother's sacrum as it comes out, so it can get compressed. And as you grow older, the septum can deviate. Then as you play sports, you're on your skateboard, your rollerblades, your bicycles.
The woman who was having the surgery who fell out on her face out of the car.
Driving in a car, having an accident, all these things are traumatic to the nose.
Yeah.
It can cause a deviated septum.
Colleen's been to all kinds of specialists. She's been to all kinds of people, and no one has ever said to her, you need this type of CAT scan, and no one's ever said, maybe it could be a deviated septum. Why is that when you say almost 25% of the people with migraines have it?
Well, oftentimes patients will present with headaches at their primary care doctors, then get referred to a neurologist. And at the neurologist, they're trying to rule out tumors, aneurysms, things of that nature. So the CAT scan or MRI is directed to the brain, which is above the sinuses. I'm talking about CAT scans of the sinus cavity, which is between the eyes and the upper lip. So we want to get that area, not just the top part.
Right. All right. Now the moment of truth for you, Colleen. The CAT scan was taken, and what did you find, Dr. Smith?
Take a look at the CAT scan. She doesn't have a huge spur of the septum, but there is a contact point between her right middle turbinate and a deviation of the septum to the right. And this is the side she has the headaches on. And so I think that if we can relieve that contact point and a few other contact points that I saw, then hopefully we'll give her a chance.